What if I told you that the pills in your medicine cabinet, the doctor you visit when you're sick, and even the diseases we're allowed to talk about are all shaped by one man? Not a doctor, not a scientist, an oil tycoon. His name was John D. Rockefeller, and by the time he was done, he didn't just own the oil flowing through America's pipelines. He owned the medicine flowing through America's veins. This isn't ancient history. This is the blueprint that built the medical system you live under right now. Every prescription, every insurance claim, every treatment your doctor is legally allowed to give you. It all traces back to a plan set in motion over a century ago, designed not to heal people, but to control them. And it worked better than anyone could have imagined. Before we dig deeper, I'm curious, where are you watching this from right now? I love hearing from people all over the world who are questioning the stories we've been told. Drop your location in the comments. Now, let's go back to the beginning. In 1839, John Davison Rockefeller was born into a modest family in upstate New York. But modest beginnings didn't last long. By the turn of the 20th century, Rockefeller controlled 90% of all oil refineries in America through his company, Standard Oil. He was the wealthiest man in modern history, with a fortune that would be worth over $400 billion today. His monopoly was absolute. His power was unmatched. But oil wasn't enough. Around 1900, something remarkable was happening in the world of science. Chemists discovered that petroleum, the black gold Rockefeller controlled, could be used for more than just fuel. They found that petrochemicals could be synthesized into a dazzling array of new compounds, plastics, dyes, fertilizers, and most importantly, pharmaceuticals. This was a revelation. For Rockefeller, it meant his empire could expand far beyond energy. He could control not just what powered machines, but what powered human bodies. There was just one problem. At the turn of the 20th century, nearly half of all medical practitioners in America didn't use synthetic drugs. They used natural remedies. Herbalists treated patients with plants that had been used for thousands of years. Homeopaths prescribed diluted substances that worked with the body's natural healing processes. Naturopaths focused on diet, exercise, and lifestyle. Chiropractors manipulated the spine. These weren't fringe practices. They were mainstream. Medical schools across the country taught these methods. Patients preferred them because they were gentle, affordable, and often more effective than the brutal treatments offered by conventional doctors at the time. Conventional medicine in the early 1900s was barbaric. Doctors routinely bled patients to release bad humors. They prescribed mercury compounds that poisoned more people than they helped. They performed surgeries without proper sterilization. Benjamin Rush, one of the most prominent physicians of his era, advocated bloodletting as a cure for yellow fever, killing countless patients in the process. No wonder people turned to natural medicine. It was safer. It made sense. But natural medicine had a fatal flaw from Rockefeller's perspective. You couldn't patent a plant. You couldn't own chamomile or echinacea or ginger. These remedies had been used freely for centuries. Anyone could grow them. Anyone could prescribe them. There was no monopoly to be built on something that grew in the ground. Synthetic drugs, on the other hand, could be patented. They could be owned. They could be sold at whatever price the market would bear. And Rockefeller, who had built his oil empire by crushing competition and controlling supply, saw the opportunity of a lifetime. So he set out to do to medicine exactly what he'd done to oil. He would eliminate the competition, standardize the industry, and establish a monopoly that would last for generations. His first move was strategic. In the early 1900s, Rockefeller began purchasing stakes in pharmaceutical companies, including the German chemical giant IG Farben. IG Farben was the largest pharmaceutical and chemical conglomerate in the world. It produced everything from aspirin to synthetic rubber. It was also the company that would later manufacture Zyklon B gas for Nazi concentration camps, and conduct horrific human experiments on prisoners. But in the early 20th century, it was simply a powerful business partner. Through IG Farben and other investments, Rockefeller positioned himself at the heart of the emerging pharmaceutical industry. But owning drug companies wasn't enough. He needed to change how medicine was taught and practiced in America. He needed to eliminate natural medicine from the equation entirely. And for that, he needed a credible front. Enter Abraham Flexner. In 1910, Flexner, an educator with no medical background, was hired by the Carnegie Foundation to conduct a comprehensive study of every medical school in the United States and Canada. The Carnegie Foundation was funded in part by Rockefeller and Andrew Carnegie, a steel magnate and Rockefeller's ally in reshaping American institutions. Flexner visited 155 medical schools over the course of 2 years. His mission, ostensibly, was to assess the quality of medical education and recommend improvements. What emerged was the Flexner Report, a document that would transform American medicine forever. Flexner's report was scathing. He condemned most medical schools as inadequate, unscientific, and dangerous. He argued that there were far too many doctors in America, and that medical education needed to be drastically reformed. Schools that didn't meet his standards, he said, should be shut down. And what were his standards? That medical schools should be university-affiliated, research-focused, and grounded in what he called scientific medicine. In practice, this meant allopathic medicine, drugs, surgery, radiation, anything based on natural remedies. Homeopathy or holistic approaches was dismissed as quackery. The report had an immediate and devastating impact. Before 1910, there were 166 medical schools in the United States. Within 2 decades, that number had been cut by more than half. By 1935, only 76 medical schools remained. Schools that taught natural medicine were closed. Schools that served black communities and women were decimated. Of the 7 medical schools for African Americans, only 2 survived: Howard University and Meharry Medical College. The consolidation was ruthless and complete. But closing schools was just the beginning. Rockefeller and Carnegie didn't just destroy the old system. They built a new one. Between 1910 and 1930, the Rockefeller Foundation poured over $100 million into medical schools that agreed to adopt the new curriculum. That's equivalent to nearly $3 billion today. But there was a catch. Schools that accepted Rockefeller money had to teach pharmaceutical-based medicine exclusively. Natural remedies, herbalism, homeopathy, all of it was banned from the curriculum. Medical students were taught that synthetic drugs were the only legitimate form of treatment. They were trained to view the body as a machine, disease as a malfunction, and drugs as the solution. The American Medical Association, which had been founded in 1847 partly to counter the rise of homeopathy, became the gatekeeper of this new system. With Rockefeller's backing, the AAA created the Council on Medical Education, which had the power to accredit medical schools and license doctors. If you didn't graduate from an AMA-approved school, you couldn't practice medicine. If your school taught natural medicine, it wouldn't be approved. The system was designed to eliminate competition at every level. Doctors who continued to practice natural medicine were attacked. They were labeled quacks and charlatans. Their licenses were revoked. Some were arrested. Homeopathic hospitals were shut down. Naturopathic colleges lost their funding and closed their doors. Within a generation, natural medicine went from being mainstream to being marginalized. And Rockefeller's pharmaceutical empire stepped in to fill the void. The control didn't stop at America's borders. Rockefeller extended his reach globally through the Rockefeller Foundations, International Health Board, and the China Medical Board. He funded medical schools in China, Europe, and Latin America, always with the same condition: They had to adopt the pharmaceutical model. Traditional Chinese medicine, Ayurvedic practices, indigenous healing methods, all of it was dismissed as primitive and unscientific. Western medicine, powered by Rockefeller's petrochemical drugs, became the global standard. By the 1930s, Rockefeller's pharmaceutical empire was vast. Sterling Drug, the largest holding company in the Rockefeller drug empire, reported profits of over 50%. IG Farben, now deeply intertwined with Rockefeller's Standard Oil, was producing synthetic drugs on an industrial scale. The alliance between Rockefeller and IG Farben became known as the Drug Trust. After World War II, IG Farben was officially dismantled due to its role in Nazi war crimes, but its component companies, Bayer, BASF, and Hoechst, survived and thrived. Today, they remain some of the largest pharmaceutical companies in the world. And then there's cancer. In 1913, the same year the Federal Reserve was established, John D. Rockefeller, Jr. provided the initial funding to establish the American Society for the Control of Cancer, which would later become the American Cancer Society. The organization was founded by 10 doctors and 5 businessmen at the Harvard Club in New York City. Its stated mission was to raise awareness about cancer and fund research, but there's a darker side to the story. Under federal law in the United States, it is illegal to treat cancer with anything other than chemotherapy, radiation, or surgery. These 3 treatments, which generate billions of dollars in revenue for pharmaceutical companies and hospitals, are the only legally sanctioned options. Alternative treatments, even those with promising results, are banned. Doctors who offer them risk losing their licenses or facing criminal charges. The average cost of cancer treatment in America exceeds $150,000. The system, critics argue, is designed not to cure cancer, but to manage it profitably. And Rockefeller's fingerprints are all over it. The consequences of Rockefeller's takeover of medicine are still visible today. Nearly 99% of pharmaceuticals contain petrochemicals derived from oil and natural gas. Painkillers, antibiotics, chemotherapy drugs, antidepressants, all of them are built on the foundation Rockefeller laid. The pharmaceutical industry is now the second largest manufacturing sector in the world after arms and weapons. Global pharmaceutical sales exceed $1 trillion annually. And the Rockefeller Empire, now operating through J.P. Morgan Chase and a network of foundations and corporations, still controls a significant portion of it. But it's not just about money. It's about control. By eliminating natural medicine, Rockefeller ensured that healthcare would be dependent on patented, expensive drugs that only his companies could produce. By standardizing medical education, he created a system where doctors are trained to prescribe pharmaceuticals and nothing else. By funding research, he determined which diseases would be studied and which treatments would be developed. And by establishing organizations like the American Cancer Society, he shaped public perception of disease and treatment. The system Rockefeller built doesn't prioritize health. It prioritizes profit. It treats symptoms, not causes. It keeps patients on medications for life rather than curing them. It criminalizes alternatives and demonizes anything that threatens the pharmaceutical monopoly. And it all started with one man's vision of absolute control. This isn't conspiracy theory. This is history. The documents are there. The reports are public. The connections are undeniable. Rockefeller didn't hide what he was doing. He did it openly, with the full support of the government, the medical establishment, and the media. And we've been living in the system he created ever since. So the next time you pick up a prescription, ask yourself, who decided this was the only option? The next time you hear that a natural remedy is unproven or dangerous, ask yourself, who made that determination? The next time you're retold that the only way to treat a disease is with expensive drugs or invasive procedures, ask yourself, who built this system and why? The answers lead back to Rockefeller. and understanding that history is the first step toward questioning the present. If this opened your eyes to something you didn't know before, do me a favor. Hit that like button. Subscribe to the channel if you haven't already. Share this video with someone who needs to hear it. And drop a comment below. Do you think modern medicine would look different if Rockefeller hadn't shaped it? What alternatives do you wish were more available? Let's keep this conversation going. The truth doesn't hide in the dark forever, but it needs people willing to shine a light on it. Thanks for watching. I'll see you in the next one.